Good day guys, and welcome to my video. Today I'll be talking about the use of carbon dioxide as a contrast agent in radiology. Now a bit about the history of the use of carbon dioxide in radiology. Carbon dioxide was used as an imaging agent in radiology since 1914 to evaluate the retroperitoneum, to image kidneys, tumors, and for venous systems. In the 1950s and early 60s, carbon dioxide was injected intravenously to delineate the right atrium for detection of pericardial effusion. Carbon dioxide angiography is a diagnostic radiographic technique in which carbon dioxide-based contrast medium is used, unlike in traditional angiography where the contrast medium which was used was usually iodine-based. So what is carbon dioxide angiography? It is a radiographic diagnostic technique in which a carbon dioxide-based contrast medium is used to see and study blood vessels. In traditional angiography, the contrast medium normally used was iodine-based. So carbon dioxide is a contrast medium, and it is a negative contrast medium, and it has a low radio opacity. It displaces the blood in the vessels and acts as a negative contrast agent. This property creates significant gradient between the radiographic density of the blood vessels and the lumen. One of the properties of carbon dioxide which make it a good contrast agent is it is non-toxic or allergenic, that is, it lacks toxicity. Carbon dioxide is also highly soluble in blood and has a low viscosity. Carbon dioxide also has a low cost since it is available naturally in the atmosphere. Another property of carbon dioxide is that it is eliminated through one pass through the pulmonary circulation, as the carbon dioxide will rapidly diffuse out through the lungs. Carbon dioxide is also injected through a low pressure injection, and carbon dioxide is also radiolucent. When administering carbon dioxide into the body, carbon dioxide can be injected through a small catheter such as the 3FR microcatheter for the diagnostic process of angiography and carbon dioxide guided endovascular interventions. With the advent of digital subtraction angiography, carbon dioxide has been used as a safe and useful alternative contrast agent in both arteriography and venography. In the case of procedures in the arterial system, it is allowed to inject carbon dioxide only below the diaphragm, while in venous systems it can be injected above the diaphragm, that is supradiaphragmatic. On why carbon dioxide angiography is preferred over other contrast agents, there are several reasons why. Gadolinium is highly toxic. Significant amounts of gadolinium stay behind and accumulate, especially in the brains and bones. Although initially believed to be without major adverse effects, gadolinium-based contrast agents cause nephrogenic systemic fibrosis in patients with chronic severe kidney disease. Most gadolinium contrast agents are excreted through the renal system, therefore have a prolonged half-life in renal failure. In the case of iodine-based contrast, some patients have an allergic reaction to the contrast, and contrast-induced acute kidney injury has been one of the most feared adverse effects of iodinated contrast media. For complications that can arise in the use of carbon dioxide as a contrast agent, contamination with room air should be avoided as it contains plenty of nitrogen, which can lead to airlocks in the blood vessels. Burning sensation, nausea, and temporary discomfort are possible sensations during carbon dioxide angiography. Carbon dioxide is also neurotoxic, that is, it should never go to the brains. This last slide shows two angiograms of blood vessels using different contrast agents. The one on the right shows where carbon dioxide has been used, and since carbon dioxide is a negative contrast medium, the blood vessels will appear lighter. Whilst on the left hand side, we have iodine, and it is a positive contrast medium, and the blood vessels will appear darker. Thank you.